A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well-being day and night. Voice of Healthcare, along with our supporting partner, Apollo Hospitals, has taken an initiative to recognize National Doctors' Day through our video series, Know Your Doctor, which aims to showcase the diverse interests and passions of our esteemed doctors. On this National Doctors' Day, let us express our gratitude to these extraordinary individuals. So let's get started with the introduction. I welcome Dr. Sandip Shah, Senior Consultant, Radio Diagnosis, Apollo Hospital. Welcome, Dr. Shah.
Yeah, thank you very much.
I wish you a very happy Doctor's Day. So to begin with our conversation, do you have any interesting stories or experiences from your medical career that have deeply influenced your perspective on patient care or the practice of medicine?
Yes, obviously, because of such a long career in my field of radiology, I obviously have come across many interesting cases, many complicated cases, many cases which really make us think in certain directions. So, if I recollect one of those cases, not much only in the recent past 1 year only. I recollect that was a middle-aged female of about 48 years old from the remote place in Gujarat, and that lady presented with a huge abdominal mass, and she was practically incapacitated and bedridden for more than a year, more than 2 years. She was completely bedridden. The mass was so huge that she was not able to even turn to the left or right also. This was the size and magnitude of the mass, and condition was really bad. She had gone to few clinics, few hospitals, but nobody dared doing further investigation or even surgery was out of question. So surgery was out of question in her case. And ultimately, she visited to our hospital. On ultrasound, it was not possible to come to any conclusion. What was the size of the mass? What was the origin of the mass? What was the texture of the mass? And what kind of treatment could we offer her? So ultimately, we decided to take her for CT scan. Now the mass and the abdominal girth was such that she could not be accommodated in the CT scan gantry also. So it was a very tough time for us to take her in the gantry. She was asked to lie oblique in the gantry, and then we could do the scan. After great difficulty, we completed the scan, and we came to the conclusion that it was a huge mass, retroperitoneal mass, and it was most probably looking like a benign mass, and it was possible to offer her surgery and get out of all predicament. So, patient was ultimately operated at our hospital, and it turned out to be a huge retroperitoneal mass weighing about 47 kg. It was actually more than the weight of her body. She was
It's a
after
weight of a person. 47 kgs, I think, yeah.
Yeah, 47 kg was the weight of the tumor, and her body weight was 42 kg after removal of the mass. So it was such a fantastic outcome. She was completely bedridden for more than 2 years. So after surgery, everything went very smooth. Post-operative course was uneventful, and by the grace of the God, patient was discharged after 10 days without any complications. And actually, patient because of this surgery, patient, we can say patient got a new life, second life. And this was a fantastic case, and probably very thrilling one. And I saw such a huge mass for the first time in my life. So it was extremely fascinating and satisfying job at the end of the day as a doctor.
Right. People are right to say that doctors are next to God, and you prove that right. So, have hats off to you for your commitment and passion to treat and take care of the patients as well. We talked about medicine, that you were intrigued about the kind of mass you saw on a patient in your life. So, are there any particular medical advancements or technologies that find intriguing, or you believe will have a very significant impact on the future of healthcare?
Uh, the medical technological advancement has been immense in last 20 to 30 years, particularly in my field of radiology, and overall medical advancement is also magnificent. If we think of telemedicine, artificial intelligence, robotic surgery, then take mRNA technology in the development of vaccine in the recent COVID-19 epidemic. So all these technologies are fantastic and they have grown in last um, 1 or 2 decades. And with the help of this technology, the medical field is advancing by leaps and bounds, and sky is the limit, I think.
Right. And in radiology also there are new technologies are coming, the AI-based detection of TB, cancer, and there are much more. I think we have come a long way and we have a long way to go. Maybe in the next 15 or 10, 15 years, we'll see a drastic shift in healthcare sector basically. And COVID had taught us to do all these telemedicine, teleconsultations and everything. So I think you are right on that part. So moving on to our last question for this conversation, what is the message that you would like to give to your fellow doctors, the budding doctors, junior resident, senior resident, and yeah.
I would like to tell my colleagues, my fellow doctors, that we are really fortunate, we are very lucky to be in this profession. It is such a noble profession, and we should try our best to uplift and maintain the pride and dignity of this profession. We should never do anything which will let us down against patient. It is really an honor and privilege to work as a physician in this field. Try to maintain it always.
Right. And one more thing that I would like to add is you should take care of yourself as much as you take care of your patients.
Yes, yes. We frequently forget this thing.
Yes, exactly. And that is the one thing that that needs to be there. So this National Doctors Day, we want to personally thank you for thank you and all the doctors who selflessly serve our nation's health. And together we salute your dedication, compassion, and unwavering commitment to our health. So thank you so much, Dr. Sandeep, for this amazing conversation with you.
Thank you. Thank you so much.
Thank you, sir.